Hi, welcome to this episode, talking about something new. The question that many young women ask, can I go for egg freezing? So what's that? Do you come across such clients?
Yes.
We are having a special guest today on our episode. She is Dr. Azadeh Patel, Chief IVF Consultant and Clinical Head at Art Fertility Center, Ahmedabad. Doctor, I want to know that what kind of people come to you and ask you for egg freezing? And does every young girl who is delaying marriage should freeze the eggs?
So, I'll first answer your second question.
Correct.
No, not all women need or require egg freezing.
Good news.
Yes. So, because of the age that we are living and the decision women are making are mainly focusing on their careers, and hence they are delaying the marriage as well as childbearing. So egg freezing becomes a very important rescue to their fertility if they are especially thinking to get married after 32 years of age, or maybe thinking of having a child after 35 years of age. So these are the women who require egg freezing. You should at least consider egg freezing. And for egg freezing, earlier is the better. So 26 is better than 30 years and 30 is better than 32.
So every year counts. If you really need to do that as per medical advice, don't delay it. Do I understand that right?
Yes.
Good. So the next question to you, doctor, that you talked about age and marriage in context to egg freezing. By any chance, can we help cancer patients to save eggs and freeze eggs so that they can have their biological material in the child in future?
Absolutely. Getting diagnosed with the cancer itself is a trauma, and especially if the woman is young and they have not even had chance to have their family, they can be counseled or given an option to freeze their eggs. This is part of fertility preservation in the cancer management. Almost all cancers that are diagnosed today, 30% of the cancer diagnosis is made at a younger age. And with the management, we have a very competent cancer management. Hence, the chances of survival are also increasing. So we can definitely counsel these patients and give them option to freeze their eggs before their chemotherapy is started.
So the timing is very important.
Correct.
So keep that in mind and just be aware about this wonderful possibility that exists for you. Why do freeze eggs and what's the objective?
So egg is the cell which after getting fertilized with the sperm starts to form the baby. Unfortunately, women have a very limited time where the eggs are good. So as in how every month is passing or every year is counting, the quality and the quantity of these eggs reduces. Hence, their fertilizing ability also reduces. So if egg freezing is done at a right age, at least we can have a backup just in case if that woman cannot conceive naturally.
That's a brilliant idea, backup. That can be a kind of your biological insurance or biological backup which can help you in future to have your own baby. One more question, doctor, that do those stored eggs remain good in quality to be used in future, and can those stored eggs are good enough to bring babies?
Yes. So we freeze the egg with the technology called as cryopreservation by vitrification. So with this, it is almost ensured that the quality of the eggs would remain as it is before freezing and after freezing. So the technology has advanced so much, and this procedure is backed up by lot of research and lot of data is available with relation to this.
How long that can be preserved?
So we can preserve it for 5 years, 10 years, 15 years, whatsoever. But the procedure to freeze the eggs is one-time procedure. It is just that you just need to ask the clinic to keep those eggs frozen for you if required. But the success depends upon a lot of other parameters. It is not only the egg or the IVF as a part of the parameter of the success, but also the sperm which is used or the uterine condition, etc., which can contribute to the success.
So how is this egg freezing done and who does it? And where can it be stored?
Egg freezing is only done at an IVF center. So not all IVF centers are similar in terms of their technology, their skills and their competence and their success rates. Egg freezing as a process involves counseling, transvaginal ultrasound, administration of daily hormonal injections, which happens for about 8 to 9 days, and a procedure to collect the eggs from your ovary, which is called as egg pickup, and this is done under anesthesia.
So that's a little complex procedure to hear, but for doctors it's a day in and out kind of a simpler procedure. Important thing is how is it preserved and the technology that supports its quality to remain for longer years. It seems it's a little complex and needs an expensive affair, and also it requires expertise to handle these eggs. Can you throw a little light in the financial aspect of this?
So yes, a very competent technology is required to do this procedure, as well as the injections which are used, which are the hormonal injection, majorly contribute to the cost of the treatment. But if I just summarize, the cost ranges from between 1.2 lakhs to 1.5 lakh rupees, and surprisingly, it is almost equivalent to a cost of an iPhone Pro Max, which
What
the
an
younger
idea.
generation keeps on changing every
Correct.
year, and they can skip it for a year to do this something which is very important.
So when it comes to the cost, all of us have been cost conscious, and egg freezing can cost you money at that point of time, but it can save a lot of money later, probably for the reason that your genetic biological material is preserved, and the indirect and invisible or intangible cost involved if this is not preserved, that woman who has undergone either cancer treatment or she has missed that train and wanting to have child at later age, she loses that chance of being a mother. That motherhood with own genetic material is being taken away, and I think that's either very, very extremely expensive, or we can say saving egg is priceless.
Priceless,
So
yes.
how we look at it, egg freezing can be little expensive, but it's all about the perception and perspective related to its objective. So as we come to the end of this, let's have some good summary points that our viewers can keep it in mind, so that if you have any young woman around and she's been thinking about egg freezing, forward this to her, and if need be, she can connect to us. So younger the better, what do you say?
Absolutely. In context to the number, which is quantity, quality, and the cost.
And when it comes to indication, it may be social or oncology.
Correct.
Right. And very important thing is that ask your doctor before starting cancer treatment. Because once you miss the train, chemo is given,
Yes. Yes.
no one can do anything
Yes,
about
it can cause
it.
a permanent damage.
So be aware about it. Choose the doctor, center, space, time, everything which is aligned to your inner voice. Technology may differ a bit, space may differ, but the trust and faith on the treating doctor, the one who is helping you to preserve your genetic material, they want to do it the best possible way. We wish that the societal scenario and the disease spectrum like cancer and issues that affects ovary of woman with the age of woman, we can conquer those problems with the help of advanced technology and the science that has been offered to us today by many IVF clinic. So Dr. Azadeh, thank you so much for adding a lot of smiles to the society with childless couples and bringing babies, and now moving a step beyond of egg pre-freezing. Would you like to say something on the closing remark before we end this episode? And if you have any questions, do connect to us, write us in the comment, and there is a phone number and email wherein you can connect. Over to you for the last comment.
Thank you so much, Darshna ma'am, for having me here. I hope this was helpful. Though there are a lot of myths and a lot of stigma still around egg freezing, but I'm sure if you come across, if you have that question on your mind, it is better that you have a consultation and clear your doubts and make a very informed decision for the same, which can be like your fixed deposit, and you might need it in future. You never know.
How beautifully you said that. Being a gynecologist and emotional health consultant, I would say that ovary is the center of femininity. As she said, the life starts from there. And anything that a woman is undergoing, wherein she feels that it's a blast on her identity as a woman, ovaries start crying and misbehaving. So rather than giving that fearful thought all the time, will my eggs be good or not, adding that dilemma or doubt, just reassure yourself that it's all fine and all is well. Goodbye. Thank you.